According to recent reports, 60% of companies are expected to do more layoffs this year. So with more layoffs, this means more people losing health coverage. Listen, we've already gutted 600,000 jobs just in January alone. That's why I created the Medical Cost Survival Guide, whether you have insurance or not. Because sadly, most people who end up losing their health coverage have no idea how to go about getting free or reduced cost medical care. And even if you have insurance, how to reduce those high hospital bills. So in this course, you will also know where and how to shop around for better prescription medication pricing without losing quality, and why sometimes it's not always a good idea to allow your provider to call in your prescription to your nearest pharmacy. Yes, you can end up actually paying more that way. You'll also understand how billing errors upped your hospital bill and how to remove those errors. Because sadly, it is up to you and me to find those errors and tell the insurance and tell the hospitals so that they remove them. So I will guide you on what you need to ask for, what documents you need to request, and how you can look at those errors step by step, as well as when to request for financial aid. This is available too, but they don't let us know. This course also covers basic first responder actions and what to keep in your home as an emergency home health kit. Why? Hospital cuts, hun. Medical staff being trimmed, locations being closed, less ambulances, they've reduced the amount of ambulances covering specific areas, which mean something like 20 minutes for the ambulance to arrive can take a couple of hours. So you need to know what to do to sustain an emergency situation. Like if somebody close to you has a stroke or a heart attack, you're going to need to know what to do to sustain them until medical care arrives. Or B, if you don't feel like waiting for a couple of hours, because I know I don't, you should be accompanying them in a taxi, or an Uber or whatever, and still sustain them in the taxi until you get to the hospital. This is the reality of the situation we're in. And if you still have insurance, I will guide you on what you need to gather before losing it. Why? Because once insurance ends, providers change. And a new doctor means delays. But you don't want that, especially if you have an existing condition. You don't want to do repeat tests because all of that is, additional costs. Listen, I'm not here to scare you, but just to provide you with simple understanding of how the system works. So now you have a plan on how to navigate it confidently and hopefully ease some of the pressure. So just click the link in my bio if you want to know more about this course. And please like, comment, and share because that helps to boost it more in the social media world because I really want it to reach people that really need this information. Thank you.